Today is the muscular system. Only about 200 or so bones. Now we're going to go to 600 muscles. But just like the bones, once you know the bone names, they just are named after where the bones are. The muscles are named after where the bones are. So this right here, the bone in the front of your head, what do you think that bone is called? What bone is this called? It's the frontal bone, right? So what muscle do you think this is? The frontalis muscle. What's this right here? What bone is right here on the sides of your head? Temporal bone. So what muscle is this? Temporalis muscle. So they name muscles where the bones are, right? And learn a little bit about where they start and where they end up. So contract and relax. So think of muscles as little tiny machines. So I mentioned about 600 different ones. We'll learn the major ones and the names for the major ones. But if you recall your anatomical terms for up, down, medial, lateral, right? Anterior, posterior, rectus, those terms will help you out when determining the muscle names. All right, functions of muscles. So definitely with the skeletal system will allow for movement. Stability. So this is in your neck. So you have muscles in the front pulling down, and then you have these muscles in the back of your neck pulling down as well. And both of them together working keeps your head still. Control body opening or passages. So here they're referring to sphincters, like where your esophagus hits your stomach, the cardiac sphincter. And muscle has a lot of blood, which can then burn sugar, releasing heat. So when it's cold, people tend to shiver, right? So that movement is to help make some body heat, warm you up. So muscle to bone, that connection is called tendon. Right? So what connects bone to bone? So we got muscle to bone, or tendons. Bone to bone are ligaments. Right? So know the difference between those two terms. Muscle to bone to bone, ligaments. Skeletal muscle. Are they under your control? Can you control skeletal muscle? Yeah. So these are going to be voluntary muscles. So you can control them. These are the only muscles that you can control. So smooth muscles, think of all your organs. Thanksgiving dinner. Can you tell your stomach to hurry up? I want more pie, pumpkin pie, more turkey? No, right? Because it's smooth muscle. It's what's called involuntary. And then lastly, we have cardiac muscle. It's also involuntary. However, its structure is more like skeletal muscle. So it's also striated as opposed to smooth muscle. There is no striation. Hold bones together. So I mentioned the neck, supporting the neck, all the muscles in front and back of the neck. You really don't know there's a problem until you sleep on your neck wrong or you get hit by a car and then the muscle gets damaged and you can't turn your head. Little tiny muscles hold your spinal column together. A lot of people who have chiropractic problems, the doctor will actually give them exercises to strengthen these muscles. That way, their spine is held in place. It's aligned and the discs are held in place. So for some people, they just need to work out a little bit. As mentioned, there's heat production, but only if there is oxygen. So if we burn sugar in the presence of oxygen, we can produce a lot of energy and a lot of heat. So when you run a lot, this oxygen level goes down, and what happens to your muscle when there's no more oxygen? Does it keep working? Have you guys ran for a long distance and then your legs start shutting down? So you get a cramp? You get hurt? Yeah? So what contributes to a cramp is that lower oxygen level. You're using it up in your muscles. What is normal body temperature? Normal body temperature. So if I was to measure a patient, how can I tell if they have a fever or if 98.6. So this is average. So you're close, 98, 98.6. So this is average. Some people are a little bit warmer, some people are a little bit cooler, but on average, 98.6. We mentioned passages, controlling passages. So sphincters are circular muscles. So from the esophagus to the stomach, right here you have a little tiny sphincter, but sometimes they let acid back up the esophagus. And then from your stomach to your intestines, you have a strong sphincter called the pyloric sphincter. So myo means muscle, cyte means cell. So another term for a muscle cell is a muscle fiber. So that just equals the same thing. So they can actually be really, really, really long. And we're going to get into the structure from the largest to the smallest. So don't worry about these terms too much. I'm going to break them down for you a little bit. Sarco means flesh. Right? So this just means muscle. Like if you have a sarcophagus, right? You bury people, you put their flesh in that little tomb. Lemma means it's just layers. Right? So this is layers of muscles. Plasm, just like the cytoplasm of a cell, it's what's inside of the cell. And then this structure, right, has that word reticulum. Just means it has a lot of surface area. And it's very important because that's where we store the calcium. And then we have our tiny, tiny little muscle fibrils. So these are the actual fibers that are arranged in a regular structure in your body. So you have thick ones and you have thin ones. All right, so let's go from largest to smallest. So when we say muscle, we mean the whole thing. Right? So everybody flex your bicep. So you have two muscles here. So that's the biggest thing, right? So covering the most is going to be the fascia. So every muscle will be inside its own sac. That way when they contract, they can slide past each other. So in your biceps, how many muscles? Two. So they're going to be completely in their own sac. So now you're going to get a bunch of muscle cells together. So here's a bunch of them. So that's going to make a muscle fascicle. And that's surrounded by endomysium. Peri means around. So around the fascicle, this whole structure here all the way around, that's the perimysium. So my question, what covers the most muscle? Is it the fascia, the perimysium, or the endomysium? right here, the fascia. Remember, every muscle is in its own sac, so that's called the fascia. So another name for that is the epi. Epi means above, so surrounding this whole muscle is the epimysium. All right, so make sure you review this image. Here's the sarcoplasmic reticulum. So it provides a lot of energy and the calcium we need for muscle contraction. Have you guys ever heard of rigor mortis? After somebody dies, their body becomes stiff, right? So that's because the energy is no longer flowing in your muscle. There's no more longer a flow of calcium, and your muscles are locked in place. So muscles are just like a machine. They kind of work similar to like a zipper, and they can get stuck as well. So that's what happens in rigor mortis. And then you got your muscle fibrils, and then your filaments. So you have thick and thin filaments. Those are your actin and myosin fibers. So make sure you're able to identify largest to smallest structure in a muscle. This slide is just a summary of the 3 types of skeletal muscle. So let's see, heart muscle, can you control it? No. Good. Skeletal muscle, of course, the only one you can control. Chemicals. So you got a nerve in your brain, and it goes along your spine all the way down, and at the end, it's going to give off some chemicals that lead to a muscle. Right? So that's what causes your muscle to fire. The nerve cell fires, it sends the electricity down to the muscle fiber, and the chemical that tells your muscle to contract is called acetylcholine. Right? So sometimes it's abbreviated ACH. Right? So that's the chemical that causes contraction. Do you guys know what Parkinson's is? Muhammad Ali, Michael J. Fox. So they tend to shake a lot. So they have too much acetylcholine, and it causes their muscles to continually contract. So once you get that signal to contract, we got to break this chemical down. This guy is the enzyme. So anything that ends in ASE is an enzyme. This enzyme breaks it down, so you no longer have the contraction. Remember rigor mortis again? If you don't have that cycling of nutrients, it's going to get stuck. Your muscle's going to get stuck. So smooth versus skeletal muscle. So when you want to control skeletal muscle, you want to control every single individual muscle. So take example, your hands. All the muscles that make your finger wiggle in every which way you want to, we want precise control. But when we talk about smooth muscle, our organs, we just tell it to speed up or slow down, and the whole organ will speed up or slow down. For example, your intestines. You get the signal to move the contents quicker, your intestines' motility will speed up. So for your organs, so visceral just means the organs again. Similar, acetylcholine and norepinephrine. So you guys probably heard of epinephrine? So skeletal muscle and smooth muscle will respond to acetylcholine, but smooth muscle will only respond to norepinephrine. Special junctions in heart muscle. So in between each heart muscle, there's actually a loose gap. So unlike skeletal muscle, where they're actually individual, here it allows for the quick flow of nutrients. In this case, electrolytes, because when the heart contracts, you want the entire upper chambers to contract at the same time, and then you want the ventricles to contract at the apex and move up. So you want that movement rather quickly. Self-exciting, that means it creates its own pace. So the sinoatrial node is a group of special cells in the right atrium that causes a spontaneous contraction. And all this is done with that electrolyte. So remember, potassium inside the cell, sodium on the outside. So that's how your heart's able to cause electricity and contract. Have you guys heard of ATP? For energy. So if you ever work out, they always talk about ATP. Have you heard of creatine? People taking creatine when they work out? Yeah, so creatine is an energy intermediate that allows your body to make ATP. Your muscles need ATP energy to contract. So another reason why you get cramps is you get low oxygen, and when you have no oxygen, you make less ATP. You make about 18 times less energy molecule. So you did say you heard of creatine, and creatine does work. It does help your muscles recover so you can do more exercise, right, and build stronger. So creatine helps transfer this phosphate to adenosine triphosphate. So here there's 3 of them. Creatine helps it gain that 3rd one. I mentioned with no oxygen, you start to get cramping. So CO2 builds up and you have a byproduct of anaerobic respiration. That's called lactic acid. So that burn you feel in your muscles when you're exercising, that is the buildup of lactic acid. So if you're a marathon runner, you train your body to get rid of this stuff so you can run 26 miles for a marathon. If you don't practice, don't train, then your body's gonna accumulate lactic acid in the muscles and you'll cramp out. You'll hit the wall. You guys ever ran 5K, 10K, marathon, Ironman? No? No? So if you see anybody with like a 13.1 sticker on their car, it's a half marathon. If they have a 26.2, that's a full marathon. If they have a 70.4, that's a half Ironman. If they have a 140.8, that's a full Ironman. So if you see those numbers on the back of people's car, that's what it means. Oxygen debt. So right now, you should be about 95% plus oxygen saturation in your blood, and your muscle will have oxygen as well. In fact, it also has myoglobin. Have you heard of hemoglobin? So heme is blood. So that's blood protein that carries oxygen. Here we have muscle proteins that can actually store oxygen. Again, if you train your body, you'll have more and more myoglobin, more oxygen storage. Here, don't worry too much about the compounds. Just know that lactic acid will build up and prevent you from making energy, and it's a vicious cycle. So all you need is just some rest, let this oxygen level go back to normal, and your cramping should go away. So definitely, the muscle shuts down. It doesn't want to damage itself anymore. And then it can no longer fire. There's some viral videos of this guy who works out and his quads were cramping, but instead of locking up, they were like contracting in weird undulating motions. It's pretty cool. So if you guys have time, look that up on YouTube on that weird cramp, waving cramp. All right, muscle. So do you guys remember the 4 tissue types? So we have epithelium, nervous tissue, muscle, and lastly connective. Right. So we got a lot of connective tissue, all of the tendons, ligaments, cartilage, bone, right? Those are all going to be connective tissue. Remember the fascia, that's the thing that covers the entire muscle. Tendons connect what together? Muscle to bone. All right. What connects bone to bone? Ligaments. Very good. All right. So now we're going to do the third one. What connects muscles to muscle? I'll give you a hint. All right. Pretty good hint, right? So we talked about bone to bone, ligaments, muscle to bone, tendon. Now muscle to muscle, aponeurosis. So why do you have a six-pack? Because you have little small muscles. So you don't have one long muscle in your abdomen. You have a little muscle, and then you have connective tissue, and then you have a little stretch of muscle, and then connective tissue, little stretch of muscle, and connective tissue. So that connective tissue is the aponeurosis. So you also have some on the side of your thigh and on your skull, right here. So when they do a facelift, they tie a knot where it's sagging, and literally they pull a string and they tie it to the aponeurosis. And that's why they have that weird pull the face up look, because it's physically tying and pulling their face up. Attachment. So where the muscle starts, they're going to call it the origin. So that's going to be where there is less movement, right? Now when the muscle contracts, when the muscle gets smaller, right, this hinge right here, the elbow gets smaller. So where there is movement, that's going to be called the insertion. Okay? So origin, less movement. Insertion, more movement. So if I do this, right, this part of the bone is not moving. This muscle is contracting. Oh, this part of the bone is moving. So origin, insertion. Make sure you can find the coracoid process. So that's on the scapula. Movement. So you have muscles on the front and the back side. So your quads are on the front side. What's on the back side? So you have quads on the front. What's the common name for the muscles on the back of your thigh? I'll give you a hint. Hamstring, yeah. So that's the common term. So the muscles on the front, the quads, make your leg straight. So it's an erector muscle, right? So when that gets smaller, your quads causes the knee to kick out. The hamstring flexes the muscle. So the ones in the front are rectus muscles. The one in the back are going to be flexor. When they get the angle smaller, they're called flexors. So the main muscle that moves is the agonist. So in your quad, how many muscles are working together? 4, right? Quadriceps. So they're working together. And then the opposite of your quads are your hammies, your hamstrings. Right? So what happens to the angle in flexion? Does it get bigger or smaller? So when you flex, what happens to this angle? You get smaller, right? So remember I had you guys stand in anatomical position. Then I had you guys go completely flexed. So whenever you're flexed, all the angles between bones get smaller. The opposite is extension. The angle gets bigger. So here's smaller angle, bigger angle. Hyperextension, that's when you go beyond. So a lot of damage happens to the knee when you get hit in the front. That causes hyperextension of the knee. Dorsa, this is for your toes. So dorsal is to point your toes up. Plantar, the bottom of your feet is the plantar. So this is to point your toes down. When you were abducted, what happens to you? When an alien abducts you, what happens? You are taken away. So when you have an abductor muscle, it takes a body part away, right? So abductor muscles take your arm away or your leg away. What if you're an addict? What happens to you? You are, let's say you're an alcoholic, right? You're drawn towards. So I have adductor muscle, brings my arm to the body. So here it is pictorially. Toes up, dorsiflexion. Toes down, plantar flexion. Extension, right? We make that angle bigger. Flexion, the angle gets smaller. And then hyperflexion, we go, hyperextension, sorry, we go beyond extension. When you are abducted, you're taken away from your family. When you're an addict, you are drawn towards. Rotation versus circumduction. So rotation is just about the axis. So that's just twisting your arm like this. Circumduction, you're making like hula hoop circles. Supination, hello. Supination versus pronation. So palm up, supination. Palm down, pronation. And those are just for the hands. Inversion and eversion. This is for the ankle, so the feet as well. So inversion, twist your ankle in. Eversion, that's when you twist your ankle outward. A little bit harder to do. Retraction, when you pull a body part back, like your head, right? You can pull the head back. Right, here's his nose and eyes. Protraction, that's when you pull the head forward. Elevation, something up, like your shoulders. Right? You can put your shoulders up, and then depression puts the shoulders way down. So turning your ankles in, turning your ankles out, eversion, putting your head forward, protraction, head back, retraction, and then your shoulders up and down. Names of muscles. All right, so about 600, but just like bones, once you know some, you're gonna know quite a bit. So let's say ribs, right? 24 ribs, knocks out over 10% of the bone names. So a lot of the muscle names will be the same as well. We'll learn the major ones. So get familiar with these chart names. These should probably be the bare minimum to start work in an MA facility. All right, so I want you guys to point to your pectoralis. Where are your pec muscles? Chest, right? All right. Point to your trapezoids, your trap muscles, trapezius. So a trapezoid kind of looks like this, right? So in your shoulder, if you work them out, those are your trapezius. Right? Where are your lats? When you work out your lats, your latissimus dorsi. Lats mean they're lateral and they're on your back. So your wings right here. So your latissimus dorsi are your wings. Point to your glutes. That one everyone knows. No one's pointing, right? But you have different parts. You're actually going to do injections to the ventral gluteal. And then some instructors will do the gluteus maximus as well. Point to your gastrocnemius. Gastrocnemius. No, gastro is normally, but this time it's your calf muscle. Yeah. The longest muscle in your body is the sartorius. It starts in your hip, ends all the way at your shin. So that's the longest muscle in your body. How many muscles in the tricep? Tri. What does tri mean? Three. There you go. So triceps brachii, plural. How many muscles in your bicep? Two. Bi is two. Bicep brachii. So there's two of them in your upper arm. Sternocleidomastoid. Point to your sternum. All right. Point to your clavicle. And then that's where the muscle starts. And then point to your mastoid process. So the muscle starts here, where the sternum and the clavicle is. And your mastoid process is that bump behind your ear. Right? That's the mastoid process. So the muscle goes from here to there. So if you know the bones and the landmarks of the bones, the muscles are going to be a lot easier. Capitis. Where do you put a cap on? On your head. So it's one of the muscles on your head. Point to the front of your head, because that muscle is the frontalis, right? So I mentioned this earlier. For around your eyes, it allows you to squint. No, sorry, this one's around your mouth. Sorry, or this is around your mouth. This one's around your eyes, oculi. Zygomatus. Point to your zygomatic arch. Do you remember? Your zygomatic arch. So you have a temporal bone, and then you have a zygomatic bone that makes a bridge. So if you look right there, so the muscle that attaches right there is the zygomatus, right? So just name the muscles on where they are located based on the bone. So if you get the bones down, you're pretty good. So in your neck, point to that flat muscle. Platysma. So you have this thin sheet of muscle right here in the front of your neck. So when they do a face lift or a neck lift, right, they're gluing the neck skin back on that muscle. The muscle of mastication is the masseter. Mastication is chewing. So point to your chewing muscle. Do you ever stop using it? When you're talking, you're breathing, you're always using it. So it's one of the stronger muscles. And then where your temporal bone is, you have the temporalis. Already mentioned pectoralis. So you have the major and the minor. Latissimus, right? Lat means like outer, towards the lateral side, and it's on the back. So those are your wings. Give you a nice diamond shape. Deltoid, diamond shape. So point to the shoulder where you have a diamond shaped muscle. Right here. So where you give the flu shot is right to the deltoid. Subscapularis. Point to your scapula. What's your scapula? Looks like a spatula. That's your shoulder blade, right? So the muscle below it on the underside, subscapularis. Infraspinous. So that's going to be above the spine. So in this case, those protrusions on the vertebrae on the backside, you have muscles in between. So right here, you have the muscles in between. Infraspinous. So on a nice, beautiful prime rib, right under the fat cap, that's the intraspinous muscle. So that's the best cut of meat. Biceps, because there's two of them, and they're located in the brachial region. Um, so point to your radius bone. Is that thumb side or pinky side? Thumb side. So this bone is gonna attach to the thumb side of your forearm. Triceps brachii in the upper bone. So don't worry too much about these. Know that on the top, all of these are going to extend the bones. So on the back side of your hand, all of those muscles are going to be called flexors. Right? So all these muscles down here flex the bone. All the muscles on the top will extend the bone. If you put your pinky and thumb together, right, about 10% of the population will be missing a muscle in their forearm. So you see this tendon? So if you have that tendon in the center, then you have the muscle. If you don't have that tendon, then you're missing that muscle. Right? Yeah. So this is, you don't need it. A lot of times if they need a tendon, they'll just harvest this one to repair something else in your body. So if I'm a flexor, am I on the top of the hand or on the back of the hand? Top or the bottom of the hand if I'm flexing? Bottom, there you go. So if I'm extending, then I am on the top of the hand. And then these just tell you where it is. It's on the radial side. This one is on the ulna side. So thumb side, pinky side. So these are all your flexors. So that's going to be on the palm side. Point to your diaphragm. Do you have one? What's your breathing muscle? What type of muscle is this? Can you control breathing? So what type of muscle is your diaphragm? Involuntary. So which type? There's only 3 types. Smooth, cardiac, or skeletal? So can you control it? Can you control it? Huh. Show me you controlling your breathing. Go.
Well, can't you control it, but don't you have to do it?
What?
Doesn't your body do it by itself?
Okay, so which one is it? So what type of muscle? Somebody said skeletal. You said involuntary, but is it cardiac or smooth? Is it cardiac? Is it heart? Can you control it?
No. You can control your breathing, but your body does it by itself.
Okay. When you're sleeping, do you have to think about breathing?
No.
No. So can you control it? No, you can't. What you're doing is you're contracting all the muscles around it, making your chest bigger and smaller, sucking in air into your lungs. But your diaphragm is smooth muscle. It just goes on its own and the brain tells it to go faster or slower. That's it. So when you're asleep, you don't have to think about it. It's automatic. So what you do is you flex the muscles in between. Inter means in between the ribs, closest ribs. So that makes the chest cavity bigger and smaller, creating vacuum to bring in air. Abdominal muscles. You have actually 4 layers of abdominal muscles. So the ones you see in the front, those are the ones that go up and down. So that's rectus. But you also have your obliques, right? So they're going to go this way on both sides, making a V pattern. And they go this way, making an A pattern as well. And then the last one we miss, transverse. So those go side to side. So in a C-section, how many layers are they cutting through? Too many. Plus the uterus, right? Plus the skin. So it's multiple layers. Your traps makes a trapezius. So here's your head, your shoulder muscles. Gives you a nice parallel trapezius. Minor pectoralis major. So the minor is underneath and the major is above. So here is that aponeurosis, all this white stuff, because your muscles don't attach to bone here. They have to attach to other muscles. Psoas muscle, that's going to be your loin. So if you ever ask for a tenderloin, this is the muscle you're eating. So that's on the inner side, and it's usually doesn't work, not flexing all the time, so that's why it stays tender. Gluteus maximus, medius, minimus, and then we also have a ventral gluteal. Abductor muscle. Is it taking the limb towards or away? The leg towards the body or away? I'm an addict. I'm drawn towards. Right? So remember those mnemonics. They'll help you. I'm an addict. I'm drawn towards stuff. Abductor muscle will draw your leg towards the body. Bicep femoris, semitenaneous, and semimembranous. So this is in the back of your leg. So these are part of the hammies. And how you know it's a hammy? Because it's like a pig in a blanket. So what's a membrane like? A nice flat sheet, right? And what does a tendon look like? A nice long hot dog. So what do we have? We have a pig in a blanket, right? So that's how you remember that's part of your hamstring. And what's ham made out of? There you go, right? So the ones that look like a tendon is the long one. The one that looks like a flat sheet is the membranous. And then these are part of your quads, right? So the muscles in the front, do they cause the muscles to go straight or bent? Straight. So they extend the leg, so they cause it to stand upright. Rectus means to be straight upright. So the largest muscle in your body is your outer thigh, vatus lateralis. And we'll be given injections in the Pharm 107 class. What's notable about the sartorius muscle? It's that one that starts from your hip all the way down to the front of your knee. What was notable about it? It was the strongest? No, longest. Sartorius. Point to your tibia. That's your shin bone. Anterior. Is that front, back, sideways? Front. So which muscle is this? It's the one that's in the front of your shin, front of your lower leg. Extends your toes. Are they on the top side or the bottom side? Top of your foot or bottom of your foot? Extends the toe. So it's going to be on the top side, right? Pointing your toes up. Gastrocnemius. This one you guys thought was the stomach. Kind of false name there, but it is the calf muscle. Right? Very painful. Solstice flexor. Which side of the leg is that on? Front or back? Flexes. Extends, flexes the toes. Will that be on the top of the toes or at the bottom? What causes you to curl your toes? The muscles on the bottom of your feet. Right, so think of it that way. These terms will help you figure out which muscles they're referring to and where they are. You're going to lose about 10% of muscle every 10 years. So when people age, they start gaining weight because they don't have muscle to burn the calories. So you're going to lose strength, lose flexibility, dexterity, and then you might need a walker. Right? So for aging patients, when they walk, have them pick up their knees as best as they can. because once they start to shuffle and not picking up their legs, that's when they'll start tripping. So make sure they have enough strength to pick up their legs. All right, let's continue on with these terms. Have you guys heard of Botox?
Yes.
Good. What is Botox? Botox is a toxin from botulism. You guys heard of botulism? So food can be contaminated, and this bacterium will produce the botulism toxin, which is Botox. So what it does is it paralyzes your nerves, so we can't tell if you're happy, sad, mad, hungry, or anything. So that's a poison you're sticking in your head. But if you have migraines, they do use Botox injections to help treat migraines. So maybe 2 for 1. Wrinkles and headaches go away. What's myo? Muscle. Algia? Pain. So this is going to cause muscle pain. Fibromyalgia. Difficulty or painful. Trophy is like development or nutrition. So if you have muscular dystrophy, the muscles don't really form. They're really weak. Rhabdomyolysis. So this can be deadly. So when your striated muscles break apart, so rhabdo is striated, myo is muscle, lysis is when they destroy, all the contents inside the muscle leaks out, and it poisons your blood. And your kidneys have to work overtime to filter out all those toxins that were inside the muscle cells. So if your muscles dissolve, your kidneys take the damage. Inflammation of the tendons. So damage, stress, like tennis elbow, that's tendinitis. Another toxin is tetanus. Have you guys gotten your tetanus shot? Gotten your booster? So what they're injecting you is a toxoid. And what that does, it'll fight and neutralize the toxin that is released by the bacterium. So they hang out on that rusty nail. So anytime you step on a rusty nail or get a cut that's dirty, it might be contaminated with tetanus, and the toxin causes lockjaw. So paralysis of, it's supposed to be face, neck and facial muscles. Weary neck. So this is if you have a little tweak to your neck to one side or the other. So that's just torsion. How do you guys like your beef? Do you guys like your steak well done, medium, rare? Medium? Okay. How do you guys like your pork? Do you guys like it well done, medium? Well, it used to be dirty. So pigs are rolling around in poop and they eat poop, and they might get cysts or parasites that are inside their muscles. And then if we don't cook, I think it's supposed to be to 165 degrees or something, then we're pretty sure that we killed off any parasites. How do you guys like your fish? Sushi? Baked? Fried? No fish? Good. So a lot of toxins in the sushi fishes. So if you want children, don't eat sushi. All right, not too bad. So that ends most of the muscles. So you have your online learning modules. And today, what do we have? 16 and 17. So just the first half of your online learning modules to do today. We'll do the rest tomorrow. I also gave you the handout for chapter 24. So you don't have to give me images of that until tomorrow. All right, so tomorrow we'll work more on the learning modules, and we'll finish up. We'll probably go over chapter 24 together.